virus, SARS-CoV-2. It is the virus that triggered the COVID-19 pandemic. And in the past year, COVID-19 has swept around the globe, infecting at last count more than 112 million people and killing nearly 2.5 million. Today, we're joined by experts in infectious diseases, public health, and pharmacy. And together, we're going to discuss the state of the pandemic and also take a look back at its impact. We'll review the latest information on vaccines, some more encouraging news we just got today, and we'll learn how to stay safe while we all wait for our turn to be vaccinated. And just a note before we do get started, if you are having any issues with the webinar or if you need some technical help, you can ask your questions in the chat and someone will get back to you. For accessibility, you can turn on live transcriptions on the bottom. It's in the bottom right part of your screen. Our ASL interpreter today is Amy. And I'd now like to introduce Dr. Julie Varghese, who is Americares Chief Medical Officer and Vice President of Americares Technical Unit. As Chief Medical Officer, Dr. Varghese is responsible for increasing access to quality medicine for low-income and uninsured patients worldwide. She's also an infectious disease specialist, which makes her, of course, uniquely qualified to help lead Americares' response to the COVID-19 pandemic. Good to see you this afternoon. Welcome.
Good to see you too, Erica. Thanks so much.
I think for many of us this past year feels like a bit of a blur. Some days it feels maybe like the pandemic just started, and on others it seems like this has been going on forever. So I thought it might be a good way to start by taking a look back. So 1 year ago today, Julie, do you remember what your thoughts were about the novel coronavirus? Did you have any inkling of what really was laying ahead?
Gosh, it does feel like a blur, I would say. Thinking back to a year ago, certainly I was aware of the disease and, I think along with everyone else trying to understand exactly, what we were dealing with. Was it similar to other coronaviruses that we'd, had in the past or something totally different? And, I think at that point, there were already more deaths from this coronavirus compared with SARS. And so it definitely seemed like we were dealing with something, even potentially more significant. So definitely had a lot of concerns. But again, we've had other outbreaks in the past. And so, thinking back to those, potentially this is something that was going to be fairly contained. But, obviously we've seen that to be quite different. And I don't think anyone probably imagined, this to be on the order of magnitude that it's been. So, I remember back to when the WHO declared this a global pandemic. I think that was really kind of a defining moment in terms of, seeing that this was going to really be bigger than anybody thought.
Yeah, I have to admit, I also remember, as a journalist, and I've been covering this for the last year, that pandemic declaration really did feel like a defining moment. And it's interesting because up until then, it felt like we were all sort of living in the moment, right? Information was coming in sort of fast and furious, but at the same time, we were learning so much. And now to look back and think, it didn't even feel like there was time to think about where were we going. We were just trying to figure out what's happening on a day to day. And now here we are. And as it began to spread, I'm sure that also changed what you were starting to see and how you were starting to look at this.
Yeah, absolutely. I think, especially those early days thinking, how are we going to contain this? How are we going to, prevent this from broader spread? And I remember really thinking a lot about our Americares teams. Our staff is scattered all across the world, being a global organization. And so thinking about staff safety and well-being, like you said, in the midst of ever-changing information, moment by moment, the news that we were getting was just, constantly fluctuating. And so I think in the midst of that, thinking about, our frontline healthcare workers day in, day out, our clinical teams were on the front lines, our distribution team was on the front lines. And I remember thinking, that maybe we'd have more control of this sooner than we've had. Particularly for the rest of our kind of US team. I still remember so clearly back in March of last year, saying our office was going to be closed for 2 weeks and then another 2 weeks and then 2 months. And, here we are almost a year later and most of our, staff is still working remotely.
Yeah, and I think for a lot of people, it looks like that may continue for some time. Given the fact that you're also an infectious disease specialist, when that declaration did come, that COVID-19 was a global pandemic, How did that maybe change the way you were looking at things? How did that influence your expectations or even your fears?
Mhm. Yeah, when something goes from kind of an epidemic, which is, an outbreak in a community or in a more kind of like controlled setting, like maybe not controlled setting, I'd say even like within a country, when that happens, that transition to a pandemic, it really means there's a more significant threat to people all around the world. And so again, kind of thinking back to how are we going to tackle this globally, whether it was with regards to information sharing or how we were going to handle kind of control of the virus spread and pandemic. So there were a lot of different kind of thoughts racing through my head at the time, just in terms of, how are we as a global community going to actually approach this? And so knowing that we were all set up to be impacted, I think we were all kind of thinking, what is the coordination that's going to take place around, tackling this pandemic?
And that's a word, that's definitely come up a lot, both positively and negatively, I would say, over the last year when we talk about coordination. So as we've watched these twists and turns, as we've watched different countries fight it differently, this global fight against COVID-19, are there some key moments, key points in the pandemic that stand out to you, or certain events that you could point to that you think really helped to shape the current situation on the ground?
Mhm. Yeah, absolutely. I think there have been defining moments personally and professionally for all of us. From a medical perspective, I remember early on in the pandemic finding out, confirmation that there was transmission of infection, even when people didn't have symptoms or were kind of in that pre-symptomatic state, and that's been a huge contributor to the spread of COVID infections. I also think, just even this week, with the US hitting over 500,000 COVID deaths, it's just a humbling reminder that we're still really knee deep in this, that there's still a ways to go. On a more positive note, I will say a defining moment for me is, back in December, seeing some of those first photos and videos of health workers getting their COVID vaccines. And, as a medical community, as a general public, I think we've just learned so much in the last year, in terms of the virus itself and protection against infection and just so many other aspects.
Yeah, I've said another emergency room physician I've been speaking with over the past year said one of the things that has really been helpful for him is how the medical community has pulled together, even just in terms of sharing information,
Mhm.
because it's all so new. Which brings me to the next point about, we have a very different, oops, my AirPod. Stand by. There we go. How does thinking about how our understanding of COVID-19, what we had then, right? Because it was so new versus where we are now, we have learned so much.
Yeah, I mean, it's amazing. I mean, it's nothing short of a medical miracle, I would say, just in terms of when I think about where we were, in January of 2020 and where we are now, a little over a year later, just the advancements that have been made scientifically, and, whether it's with regards to the vaccines, we don't have just one vaccine, we have multiple vaccines, that are authorized now and many more, in the pipeline, therapies for COVID. This is just, such a testament, I think, to the coordination, the collaboration across the scientific community, the pharmaceutical industry, tremendous financial, investments. And I think it's really, just says so much about how everyone's come together to really tackle this as a global community.
Yeah, absolutely. And in terms of the vaccine, right? We're seeing developments, almost daily. We got some good news today, I know, in terms of Johnson and Johnson. And so as we move on to vaccines, I want to bring in Dr. Aaron Briggs. Aaron, good to see you.
Hi, Erica. Nice to see you.
So Dr. Briggs is America's senior pharmacist. So she reviews medical donations made to Americares and is a key member of the organization's medical team, advising its clinical and emergency teams responding to COVID. So Erin, I'm just curious, when we look at the current landscape of COVID vaccines, we reached out to some Americares supporters prior to this live stream. We asked them some of their questions around COVID, and there were definitely a few people who were asking about the different vaccine options. So can you just walk us through which vaccines are currently approved for use and how many more are still in trials?
Yeah, absolutely. So within the United States, we currently have two vaccines vaccines that have been authorized. That's the Moderna and the Pfizer vaccine. And the Food and Drug Administration, or the FDA, is responsible for reviewing and authorizing the vaccines after they've reviewed the clinical trial results. Now, as you mentioned today, we did hear some good news that the FDA reviewed the Johnson & Johnson vaccine, and it looks like they may have passed the requirements to get that emergency use authorization. So we may see that Johnson & Johnson vaccine being authorized soon, in which case we'll have 3 vaccines within the United States. Now, the World Health Organization does it on a worldwide scale. They also review and authorize vaccines. So far, they've authorized the Pfizer vaccine as well as 2 versions of the AstraZeneca vaccine. Now, Johnson & Johnson also submitted their trial results to the WHO, so we may see that authorization in a couple weeks. Worldwide, we have about 10 vaccines that are being administered, and those vaccines have been authorized by various country regulatory authorities. But we still have a couple hundred vaccines currently in preclinical and clinical development.
That is really remarkable. I mean, if we just take a minute to think about, we keep hearing medical miracle when we talk about the vaccine, but it really is that there has been such intense development on such a broad scale in such a short period of time. Yay, science, once again. Erin, while we are on the topic of vaccines, there's a lot of talk about the different vaccines that are out there. In fact, we got this question from Anthony in New Jersey who asks, I know there are a few options. Which vaccine should I take?
Yeah, so right now, you may not have an option of which vaccine is available because we're seeing worldwide and definitely in the United States that the demand far exceeds the supply. So right now it's recommended to take whichever vaccine is made available to you. The one thing to keep in mind with these 2-dose series for Pfizer Moderna vaccine, you have to get the same vaccine for the first shot and the second shot because there's no data yet that the vaccines can be mixed.
Excellent point there. When it comes to, which sort of brings us into our next point, which is the safety of the vaccines. How do we know they're safe? What is the data? Tell us about that.
Yeah, so the original clinical trial results did not show any serious safety concerns with the vaccines. And then the FDA and the Centers for Disease Control and Prevention, or the CDC in the United States, is continuing to monitor and follow up on participants, not only in the clinical trials, but also for the people that are receiving the vaccines currently. So as we're seeing millions of people being vaccinated, we're actually still not seeing serious safety concerns, although some very rare adverse events have been reported, but these are really, really uncommon. So of course, we're seeing the side effects that are really common with vaccines, which are the pain at injection site, headache, fatigue, just not feeling well. But these side effects, not only are they very common, they don't mean that you've gotten COVID-19 because you got the vaccine. It actually is good news because it means that your immune system is responding to the vaccine and it's working.
We love that. We love good news. And there's actually more good news too when we talk about how effective these vaccines are. I mean, it's kind of unheard of.
It really is. Yeah. So the clinical trials tested a few primary endpoints. They tested whether the vaccine prevented moderate to severe disease, but then it also tested whether the vaccine reduced hospitalizations and deaths. And in the Pfizer and Moderna vaccines, both vaccines were about 95% effective against symptomatic COVID-19. So really good trial results. Now, we're seeing varying degrees of efficacy among the other vaccines that are being used worldwide, but I can say that we're seeing very effective vaccines at preventing hospitalization and death, which is really important right now.
Yeah, it certainly is. There's been so much talk recently about these COVID-19 variants. And some of them have people understandably concerned. They spread a lot faster in many cases. So not only spreading more easily and more quickly, but of course, the concern there is that then that could lead to an increase in the number of cases that may need hospitalization, stressing the health system, potentially leading to more deaths. So how did the current vaccines protect against these variants?
So the variants we've been hearing most about recently is the United Kingdom variant and the South African variants, which are just named based on their country of origin. And we're still learning a lot about not only the variants, but how the vaccines are going to work against them. So far, what we do know is that the Pfizer and Moderna vaccines available in the US do provide some level of protection against the variants. But we're just going to have to wait and learn more information. And likely what we're going to see as researchers continue to study the variants is that we may have to have a modified COVID-19 vaccine that works even better to protect us against the variant. Or we may see down the line that a booster shot is required. So likely we're going to know more about this as time goes by.
Yeah, and it sounds like, certainly based off of there was a House hearing yesterday with 5 vaccine makers. It sounds like they all sort of have those studies in the works, or they're working up to them, which is good news. So as we wait for more information on potentially modified vaccines and whether they'll be necessary to protect against the variant, is there any reason with more of these variants spreading that we should not get vaccinated when it's our turn?
No reason at all. Absolutely get vaccinated. The vaccines are safe. So they're going to prevent illness, they're going to keep you out of the hospital, and they're going to prevent death. And also, more importantly, getting as many people vaccinated as quickly as possible is really going to help cut infection rates. We really need the majority of the global population to be vaccinated to not only help slow the spread, but hopefully to end the pandemic.
I would love to see that, as I know you all would as well. So the good news is it definitely seems like, at least here in the US, as I've been following that, we are seeing vaccinations increase. A lot of us obviously eager to get that vaccine. Many of us are going to still have to wait a little while, but eager to get it too because of what that may mean in terms of seeing family and loved ones. So once someone is fully vaccinated, what does that mean? Can you go see your loved one once they're vaccinated?
Yeah, so we know the vaccines are really good at preventing serious illness, but we still are learning about how the vaccines can help reduce transmission rates. So as we continue learning about not only the transmission rates of the vaccine, but also these new variants, it's going to be important to continue to be cautious about seeing people. Another thing I'd like to point out is that keep in mind with the Moderna and Pfizer vaccines, or any other vaccine that requires 2 shots, you need to get the 2 shots to get the full protection. Plus, it does take about 2 weeks after the second shot to get that full protection from the vaccine. So until more people are vaccinated and there's less virus circulating in the community, the safest approach right now is to still meet virtually, meet outdoors, wear a mask, and continue practicing social distancing. And then, of course, if you have access to the vaccine and you're eligible for it, it's really important to get the vaccine.
Yeah, absolutely. In terms of access to the vaccine, we're seeing eligibility expand in many cases, but do we have a sense of when, more of the general public can expect to be vaccinated?
Yeah, so within the United States, vaccine distribution has been rolled out in phases, and then the phases vary from state to state, which makes things challenging and a little confusing sometimes. So current information on which phase each state is in can typically be found at either the state, county, or city health department website or by calling. Right now, I can say that most states are in the vaccination phase of healthcare workers, essential workers, nursing homes, and then some states are moving into vaccinating age groups such as 65 and older. And then we're even seeing some states moving into vaccinating people with underlying health conditions. So as more vaccines become available, we're going to start seeing more age groups eligible for inclusion. So we'll start seeing even younger people vaccinated. And we're really hoping that vaccines will be widely available within the United States by about late summer.
Which is amazing. I can't wait for that. You mentioned that even after you get the vaccine, up until and even after, we're going to need to keep up rather with the public health measures that we've all become experts at, I think, in the past year. We've heard a little bit more lately about double masking. Does it make more sense now to use 2 masks as opposed to just 1?
Well, it really depends. So the CDC did come out with a recommendation for double masking. And a lot of the recommendation also has to do about how snugly your mask fits. It's really important to have a nice tight fit around your nose and your mouth. So double masking recommendations are really about putting a disposable mask on first. And if you don't have a tight, snug fit with a disposable mask, it's perfectly fine to take a cloth mask, preferably with 2 layers, and put it over top. You need to make sure that you can still breathe comfortably, but the key is nice, snug, tight fit around your nose and your mouth.
That we can do. And Julie, I know this is something too Americares has been working on too, to really get that message out.
Absolutely. I think, as Erin's already pointed out, continuing those messages of the importance of prevention, as we're all waiting our turn for vaccination is really so essential.
And so as we look at what's happening there, there's actually a toolkit that Americares has put together. Tell us a little bit more about that, Julie.
Sure. I think I'll start by saying we're all in a state of pandemic fatigue, myself included. And so, kind of hearing these messages, can definitely be tough. We've been doing this for a year now, but Americares is looking for different ways to support, the community and medical community in terms of helping to share that message. So we've developed a toolkit, as you said, that includes, key messaging in terms of just easy ways to remember the importance of physical distancing, wearing masks, washing hands, and you can find that information at americares.org /take action now. Just again, want to acknowledge sometimes these conversations are tough to have with friends and loved ones and family members. And so we're trying to do our part to help make it easier to have some of these conversations and share the messaging.
Which is fantastic. So as we look at Americares, which is of course a global health organization, I want to talk a little bit more about how Americares is responding to COVID-19 more broadly, not just in the US, and also what the organization is hoping the global response will look like going forward. So for that, I'd like to bring in Dr. Rashad Massoud. Always good to see you, Rashad.
Thank you, Erica.
So Dr. Massoud is Americare's Senior Vice President and Chief Program Officer. He oversees Americare's health programs for people affected by poverty or disaster. So that includes its work with the uninsured in the United States, its emergency response team, and its global distribution of medicine and supplies. Dr. Massoud also leads Americare's global response to the COVID-19 pandemic. So, give us a sense, Rashad, can you briefly summarize what the response has been from Americare's to COVID-19?
Well, America's response has focused on 3 key areas: increasing the access to personal protective equipment, what we call PPE, and critical supplies related to COVID, providing primary care services, and providing mental health support and essential training for frontline health workers. The access to supplies was particularly important in the early months of the pandemic because of the global shortage of PPEs. And these are critical for treatment. They keep health workers and patients safe. Primary care services, just because we have an ongoing pandemic, it doesn't mean that other diseases and illnesses go away. It's really important to maintain continuity of services. A third of what we call excess mortality, that is mortality in 2020 compared to 2019, is due to non-COVID causes, which makes us really think hard about the importance of continuity of service. Mental health support and training. The pandemic has really had a major toll on health workers and their well-being. They need this mental health support to take care of themselves and their patients. And health workers have also had to adopt new skills rapidly, things like pivoting to telehealth. These trainings really help them learn quickly and efficiently.
Yeah, absolutely. It really is, it's a whole approach, right? Not just as an organization, but dealing with the whole person too, who is living through this pandemic. So based on what has happened over the past year and the response and what your team has learned, do you see Americare's response changing at all going forward?
Well, yes and no. In part, we are continuing what we're doing. So, a lot of it remains there, but we're also evolving and fine-tuning what we're doing. Julie talked about the global community learning, and we're learning so much more about the virus. At Americares, we're also learning. Our COVID strategy response going forward includes some of what we've done before, things like the access to medicines, the mental health, the continuity of services. But then we're also now adding a public health campaign, and we're exploring new ways to support vaccinations.
So as we look at what Americares is planning to do moving forward, this really is, as you pointed out, and as we talked about just on this panel, this really is a global approach that's needed. So if we look at it from that perspective, Rashad, what do you think are the most important next steps globally toward ending the pandemic? Is it vaccine equity? Does it go beyond that?
Well, first of all, I believe that nobody is safe until everybody is safe. And ending this pandemic will require a global effort. Erin mentioned that we need a global vaccination program. We have 4 months worth of data that show us that people who received the vaccine had a full immune response over that period of time, which is extremely promising. And we can expect that this immune response will probably last for a year, maybe, or so. It could be longer, but we don't know yet. Time will tell. The situation we really need to avoid is one where we end up having to live with the virus. And to avoid that, what we need is rapid scale up of the vaccination program. Again, just like Erin was saying. And by rapid scale up, I mean, what we really want to try and do is get the last group vaccinated before the first group who got vaccinated lose their immune response. Now, that's going to require matching the supply of vaccines that we have to the demand that's needed. But more importantly, and I think we're seeing this now all over the news, is that we really need a good vaccine administration setup. The vaccine administration is really the intersection of supply and demand, and that we have to get right. Now, we also need to be prepared for challenges that are coming up. Last week, we saw how extreme weather can impact the vaccination distribution in Texas. And it's actually disrupted vaccination programs across the 50 states. To me, what's also really important is that we cannot rely on the vaccination program as a singular strategy for ending the pandemic. We still need to continue the preventive measures. These are, everybody knows them. No large gatherings, physical distancing, mask wearing, hand washing. But more importantly, in the US, we still lack a good contact tracing mechanism. That's not been instilled. And with the emergence of new variants, I really worry that this could be the Achilles heel.
Yeah, that tracing and the sequencing here in the US as well appears to be slow, to put it mildly. So based on what we know now, there's so much talk at this point, as Julie pointed out, we all have pandemic fatigue. And so everybody wants to talk about what life is going to be like after the pandemic, post-pandemic life. What do you see? What do you see that looking like?
Well, first of all, I don't think the post-pandemic norm is going to be the norm that we had prior to the pandemic. I think we've got a lot of opportunities for change, and we've learned a lot about things that we can change and probably will change as we go into the future. First of all, health equity. You realize how important this is. The response to infectious diseases, global and regional cooperation, and then how we connect, how we work, how we travel. All of those are things that are now probably going to change in one way or the other.
Yeah, in terms of how we connect, how we travel. We definitely have received some questions about global vaccination, the process of getting vaccinated. So I want to bring Julie and Aaron back into the conversation here. In terms of some of those questions that we were getting, it was about the relationship between the vaccine and COVID itself. Dawn in New York asked, can you get COVID from the vaccine? And why do some people get sick when they get the vaccine? Erin, you touched on this a little bit earlier, but can you expand on that for us?
Yeah, of course. So you don't get COVID-19 from the vaccine. It's not a live virus. There's no way for you to actually get sick. So if you feel bad after the vaccine, and not everybody does, but some people are experiencing these kinds of like flu-like symptoms. It's not that you're sick. It's actually that your body is reacting to the vaccine because it's building immune response. It's identifying an antigen, so a virus, and it's attacking it and then creating antibodies to remember it later. So this is good news. So it may make you feel bad, but it's actually your body's way of reacting to the vaccine and building up the antibodies that you want to see, so that if you do get exposed later, your body will know how to fight COVID-19.
Speaking of antibodies, while we're talking about, COVID and how your body interacts with the vaccine, you stress the importance of getting the full dose there, both shots. Melanie asked, though, if someone has had COVID already, do they really need the second dose of the vaccine?
Yeah, this has been a hot topic lately. I do want to start by emphasizing that you still need to receive both shots of the vaccines that are available in the United States right now. So actually, any shot for that matter that's part of a 2-dose series still requires 2 shots, because right now there's no recommendations about getting 1 shot. That being said, researchers are testing whether those who have had COVID-19 and recovered can get a strong immune response with just 1 shot. So it's still a little too early for us to know what types of results we're going to see from these clinical trials. So right now, you still need to get both shots of the vaccine, but we may see updates to vaccine schedules in the future.
Rashad, Johnny in Orlando is asking about cost and whether the vaccine will be free when it is widely available.
In the US, the federal government has purchased hundreds of millions of doses on behalf of patients. So the federal health officials have said that the COVID vaccine will be free to every American who wants it in 2021. And this includes uninsured patients. Also, no surprise billing is allowed. Congress has passed legislation last year that prevents insurers from applying co-payments or deductibles. Now, things may change after the public health emergency is over, but for now, the vaccine is expected to be free of charge to every American, no matter which vaccine you receive. Globally, this will depend on regional and local regulations.
In terms of those global regulations, Lou in Atlanta is asking, what do we know about vaccine distribution, what it will look like for lower income countries outside the US? This is a major concern.
Yeah. So global vaccine distribution will depend partly on the country's engagement with COVAX. Just as background, COVAX is a global effort to get the COVID vaccines to low and middle income countries. It was started last year by the World Health Organization. And 2 groups have come together to, in addition to WHO, to work on getting vaccines to lower income countries. Particularly, the 2 groups are Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovations. Basically, it's a global group working to accelerate the development, production, and equitable access to the COVID vaccines and the ability to procure vaccine supplies. The hope is that donated vaccines and supplies will help protect those most at risk of contracting COVID around the world.
Erin, we have another question for you. So Leslie had a question about Tylenol's impact on the vaccine. We know some people experience discomfort after the vaccine, as you talked about, and might want to take some kind of pain reliever, but could doing so in any way reduce the effectiveness of the vaccine?
Yeah, so studies have shown that taking an over-the-counter pain reliever like Tylenol or ibuprofen after the vaccine is fine and it's safe to do. However, there have been some experts making recommendations that taking an over-the-counter pain reliever before the vaccine to anticipate possibly feeling bad may possibly affect how well the vaccine works. So it's not recommended to take anything before you get the vaccine, but you can take something after the vaccine if you need it, if you don't feel well. And of course, it's always a good idea to consult with your healthcare provider as well.
We received a lot of questions about what's actually in the vaccine. What are the ingredients? And so can one of you walk us through that? Julie, can you walk us through that?
Sure, happy to. Although I will say, I don't know that we have enough time to walk through all of the exact ingredients within these vaccines. But that being said, the Food and Drug Administration that Erin had mentioned earlier, the FDA, has really detailed kind of information sheets on the exact ingredients in each of the vaccines. And I'd say, especially for someone who's had a reaction to vaccines in the past, it would be really helpful to just review what's in each of these vaccines that they're potentially going to get, and to talk with their healthcare provider. As Erin mentioned, for the most part, these vaccines are very safe, but certainly if you've had a reaction before, it's good to talk with your healthcare provider. And if you need to find that information, it's on the FDA website, which is just fda.gov. So as more and more vaccines come down the pipeline, I imagine they'll keep that information updated for each of the specific vaccines.
Great. This has been wonderful today. I have to say, it's a treat to be able to see all of your faces, since we are still living this virtual life, and to be able to say thank you almost in person for all of the work that you're doing every single day with Americares, and just helping so many people here in the United States and around the globe, and helping all of us better understand where we are today. And just really quickly, before I let each of you go, I'm just going to ask if you could give us each, maybe one final thought, just one takeaway, either a takeaway from this past year, or even something that you're looking forward to. I'll let you decide. I'll let you decide which one. So I'm going to go down the line on the screen on my computer, and Julie, I'll start with you.
That is a great question. I think there's lots of takeaways from this last year, and things that I'm personally looking forward to, kind of as the pandemic starts to slowly resolve. I think I'll just really reiterate, some of the messages we're sharing as an organization. There is so much hope with the vaccines that we're seeing, online, and that's really going to be key to ending this pandemic. That being said, I think just reiterating the importance of continued prevention, is really, really essential. So, as more and more people get vaccinated, we're seeing cases go down, and hospitalizations, death rates, like all of that is so encouraging. But I would just really continue to reiterate the messaging that prevention is essential. So physical distancing, masking, washing your hands, especially as you're waiting your turn to get vaccinated.
Great. Thank you. Erin?
Yeah, I would say, I think one of the most fascinating things to witness over the last year is the global collaboration to develop a vaccine that is not only safe but effective. I think that's something that none of us in now or in history have ever been able to witness. So it's an amazing feat. And now that we're just in the beginning of stages of this vaccine being available, I'd like to reiterate that the vaccine is safe and effective. We need to be diligent about getting as many people vaccinated as possible. So if you find yourself having issues with not enrollment of the vaccine, or this is going to take some time. So be patient, be diligent, get the vaccine, and just as Julie said, continue following COVID-19 precautions. And we'll get there. We'll get to global mass vaccination soon enough.
We can see that light. It's there. We just need to hold on a little longer. Rashad, how about you?
Well, the big thing that's on my mind is we get through this, but it's not going to be the last pandemic we'll see. It's unfortunate, but I can't say that with any certainty that this is the last one. So the big lessons are about how we prepare, how we collaborate globally, and how we as societies and human beings respond on an individual basis and on a community basis when something like this happens. I think there are a lot of lessons for us on these fronts in preparation for anything that happens in the future. Heaven forbid, but if it does, we should be ready for it.
Yeah, it certainly doesn't hurt to be prepared. And I think you bring up such a great point about the fact that you've all talked about how this has been a global response, but it is a reality. We are in this together, and our individual actions say a lot about those around us and how we value the people around us, whether we know them or not. And hopefully that's a lesson we're all taking as well. We are out of time, so we're going to end there. But Julie, Aaron, Rashad, thank you all again so much. Thank you for all of the wisdom that you have shared with us today. Again, thank you for all of the work that you're doing at Americares and with your COVID-19 responses. A heartfelt thank you to everyone who joined us today. And I'd encourage you, if you'd like to find out more about Americares COVID-19 response, just log on to americares.org/COVID-19. If you have any questions we didn't answer, send them our way. You can email us, info@americares.org. And just really quickly, that toolkit that Dr. Varghese mentioned, that Julie mentioned, that is available at americares.org/take action now. Thank you again for your time, for your interest, and for your support.